Question 1. A nurse is assessing a patient with suspected hyperthyroidism. Which symptom requires immediate prioritization for further evaluation to ensure patient safety? A. Weight loss despite increased appetite. B. Tremors and nervousness. C. Palpitations and tachycardia. D. Heat intolerance and sweating. Answer. C. Palpitations and tachycardia. Question 2. A patient with Cushing syndrome is admitted to the medical unit. Which task can the nurse appropriately delegate to a licensed practical nurse, LPN, within their scope of practice? A. Developing a care plan for cortisol management. B. Administering oral hydrocortisone as prescribed. C. Interpreting laboratory cortisol levels. D. Educating the patient on surgical interventions. Answer. B. Administering oral hydrocortisone as prescribed. Question 3. A nurse is triaging patients in the emergency department. Which patient with an endocrine disorder should be prioritized for immediate intervention? A. A patient with hypothyroidism reporting fatigue. B. A patient with Addison's disease presenting with hypotension and confusion. C. A patient with diabetes insipidus reporting thirst. D. A patient with hyperparathyroidism reporting muscle aches. Answer. B. A patient with Addison's disease presenting with hypotension and confusion. Question 4. A nurse is caring for a patient with diabetic ketoacidosis, DKA. Which intervention should the nurse prioritize to stabilize the patient? A. Administering oral glucose tablets. B. Initiating insulin infusion as ordered. C. Providing dietary counseling. D. Encouraging ambulation to improve circulation. Answer. B. Initiating insulin infusion as ordered. Question 5. A nurse is assigning tasks for a patient with pheochromocytoma. Which responsibility is most appropriate for a certified nursing assistant, CNA? A. Monitoring blood pressure every 15 minutes. B. Assisting with activities of daily living. C. Administering antihypertensive medications. D. Assessing catecholamine levels. Answer. B. Assisting with activities of daily living. Question 6. A patient with Graves' disease is experiencing thyroid storm. Which clinical finding requires immediate nursing intervention? A. Elevated blood pressure and fever. B. Increased appetite and weight loss. C. Dry skin and hair loss. D. Constipation and lethargy. Answer. A. Elevated blood pressure and fever. Question 7. A nurse is delegating care for a patient with hypoparathyroidism. Which task is appropriate to assign to an unlicensed assistive personnel UAP? A. Monitoring for signs of tetany. B. Administering calcium supplements. C. Assisting with feeding and hydration. D. Evaluating response to vitamin D therapy. Answer. C. Assisting with feeding and hydration. Question 8. A patient with type 1 diabetes is admitted with hyperglycemia. Which action reflects appropriate decision-making to ensure patient safety? A. Delaying insulin administration until glucose levels are confirmed. B. Checking blood glucose and administering insulin per protocol. C. Encouraging high carbohydrate snacks to stabilize glucose. D. Restricting all fluids to prevent further glucose spikes. Answer. B. Checking blood glucose and administering insulin per protocol. Question 9. A nurse is managing a patient with syndrome of inappropriate antidiuretic hormone SIAD. Which intervention should be prioritized? A. Encouraging increased fluid intake. B. Administering hypertonic saline as ordered. C. Providing a high-sodium diet. D. Restricting sodium intake. Answer. B. Administering hypertonic saline as ordered. Question 10. A nurse is assigning care for a patient with acromegaly. Which task is appropriate for a registered nurse, RN, rather than an LPN? A. Administering subcutaneous somatostatin analogs. B. Monitoring for signs of heart failure. C. Assisting with range of motion exercises. D. Recording daily weight measurements. Answer: B. Monitoring for signs of heart failure. Question 11. A patient with Addison's disease is experiencing an adrenal crisis. Which action should the nurse prioritize? A. Administering oral corticosteroids. B. Initiating intravenous hydrocortisone. C. Encouraging a high potassium diet. D. Restricting fluid intake. Answer: B. Initiating intravenous hydrocortisone. Question 12. A nurse is delegating tasks for a patient with hyperaldosteronism. Which task is appropriate for a UAP? A. Monitoring for signs of hypokalemia. B. Assisting with ambulation and transfers. C. Administering spironolactone as prescribed. D. Evaluating response to diuretic therapy. Answer: B. Assisting with ambulation and transfers. Question 13. A patient with hypothyroidism is admitted with myxedema coma. Which finding requires immediate nursing intervention? A. Weight gain and dry skin. B. Hypothermia and bradycardia. C. Hair loss and fatigue. D. Constipation and lethargy. Answer: B. Hypothermia and bradycardia. Question 14. A nurse is prioritizing care for multiple patients. Which patient with an endocrine disorder requires immediate attention? A. A patient with hyperthyroidism reporting anxiety. B. A patient with diabetic ketoacidosis with a pH of 7.1. C. A patient with Cushing's syndrome reporting weight gain. D. A patient with diabetes insipidus reporting polyuria. Answer: B. A patient with diabetic ketoacidosis with a pH of 7.1. Question 15. A nurse is delegating care for a patient with hyperparathyroidism. Which task is appropriate for an LPN? A. Assessing for signs of hypercalcemia. B. Administering calcitonin as prescribed. C. Developing a plan for calcium management. D. Interpreting parathyroid hormone levels. Answer: B. Administering calcitonin as prescribed. Question 16. A patient with type 2 diabetes is at risk for hypoglycemia. Which nursing action reflects appropriate decision-making? A. Administering insulin without checking glucose levels. B. Providing a carbohydrate snack if glucose is below 70 milligrams per deciliter. C. Restricting all carbohydrate intake. D. Encouraging exercise during low glucose episodes. Answer: B. Providing a carbohydrate snack if glucose is below 70 milligrams per deciliter. Question 17. A nurse is assigning tasks for a patient with pituitary adenoma. Which responsibility is appropriate for a CNA? A. Monitoring for signs of diabetes insipidus. B. Assisting with personal hygiene. C. Administering desmopressin as prescribed. D. Evaluating response to hormone therapy. Answer: B. Assisting with personal hygiene. Question 18. A patient with hyperthyroidism is scheduled for radioactive iodine therapy. Which nursing action ensures patient safety? A. Encouraging fluid restriction before the procedure. B. Educating the patient on radiation safety precautions. C. Administering antithyroid drugs post-procedure. D. Allowing unrestricted visitor access post-therapy. Answer: B. Educating the patient on radiation safety precautions. Question 19. A nurse is triaging patients with endocrine disorders. Which patient should be prioritized for immediate care? A. A patient with hypothyroidism reporting weight gain. B. A patient with pheochromocytoma with a blood pressure of 220/110 mmHg. C. A patient with acromegaly reporting joint pain. D. A patient with SIAD reporting mild headache. Answer: B. A patient with pheochromocytoma with a blood pressure of 220/110 mmHg. Question 20. A nurse is delegating care for a patient with diabetes insipidus. Which task is appropriate for an RN rather than a UAP? A. Assisting with oral hydration. B. Monitoring for signs of dehydration. C. Recording fluid intake and output. D. Providing assistance with ambulation. Answer: B. Monitoring for signs of dehydration. Question 21. A nurse is caring for a patient with suspected hypopituitarism. Which symptoms should be prioritized for immediate evaluation to ensure patient safety? A. Fatigue and weakness. B. Hypotension and dizziness. C. Weight gain and cold intolerance. D. Decreased libido and depression. Answer: B. Hypotension and dizziness. Question 22. A patient with primary hyperparathyroidism is admitted. Which task can the nurse appropriately delegate to a licensed practical nurse, LPN? A. Assessing for signs of renal calculi. B. Administering oral phosphate binders as prescribed. C. Developing a plan for surgical intervention. D. Interpreting serum calcium levels. Answer: B. Administering oral phosphate binders as prescribed. Question 23. A nurse is triaging patients in an outpatient clinic. Which patient with an endocrine disorder requires urgent attention? A. A patient with hyperthyroidism reporting weight loss. B. A patient with adrenal insufficiency presenting with severe dehydration. C. A patient with Cushing's syndrome reporting bruising. D. A patient with hypothyroidism reporting dry skin. Answer: B. A patient with adrenal insufficiency presenting with severe dehydration. Question 24. A patient with hyperglycemic hyperosmolar state, HHS, is admitted. Which intervention should the nurse prioritize? A. Administering subcutaneous insulin immediately. B. Initiating intravenous fluid replacement as ordered. C. Providing a high-carbohydrate meal. D. Restricting all fluids to reduce serum osmolality. Answer: B. Initiating intravenous fluid replacement as ordered. Question 25. A nurse is assigning tasks for a patient with medullary thyroid carcinoma. Which responsibility is appropriate for a certified nursing assistant, CNA? A. Monitoring for signs of hypercalcemia. B. Assisting with turning and repositioning. C. Administering calcitonin as prescribed. D. Evaluating response to chemotherapy. Answer: B. Assisting with turning and repositioning. Question 26. A patient with thyrotoxicosis is at risk for cardiac complications. Which finding requires immediate nursing intervention? A. Increased appetite and diarrhea. B. Atrial fibrillation and chest pain. C. Tremors and anxiety. D. Sweating and heat intolerance. Answer: B. Atrial fibrillation and chest pain. Question 27. A nurse is delegating care for a patient with secondary adrenal insufficiency. Which task is appropriate for an unlicensed assistive personnel UAP? A. Monitoring for signs of hypoglycemia. B. Assisting with oral hygiene. C. Administering glucocorticoid replacement. D. Assessing response to stress dosing. Answer: B. Assisting with oral hygiene. Question 28. A patient with type 2 diabetes presents with a foot ulcer. Which action reflects appropriate decision-making to ensure patient safety? A. Applying a heating pad to improve circulation. B. Inspecting the ulcer and consulting wound care. C. Encouraging ambulation to promote healing. D. Delaying wound assessment until discharge. Answer: B. Inspecting the ulcer and consulting wound care. Question 29. A nurse is managing a patient with diabetes insipidus post-pituitary surgery. Which intervention should be prioritized? A. Restricting fluid intake to prevent dilutional hyponatremia. B. Administering desmopressin as prescribed. C. Encouraging a high-sodium diet. D. Limiting monitoring of urine output. Answer. B. Administering desmopressin as prescribed. Question 30. A nurse is assigning care for a patient with prolactinoma. Which task is appropriate for a registered nurse, RN, rather than an LPN? A. Administering oral cabergoline as prescribed. B. Assessing for visual field deficits. C. Recording daily fluid intake. D. Assisting with medication reconciliation. Answer. B. Assessing for visual field deficits. Question 31. A patient with hyperthyroidism is experiencing heat intolerance and palpitations. Which action should the nurse prioritize? A. Providing a warm blanket for comfort. B. Administering beta blockers as ordered. C. Encouraging high-calorie snacks. D. Restricting physical activity completely. Answer. B. Administering beta blockers as ordered. Question 32. A nurse is delegating tasks for a patient with hypocalcemia post-thyroidectomy. Which task is appropriate for a UAP? A. Monitoring for Chvostek sign. B. Assisting with meal preparation. C. Administering intravenous calcium gluconate. D. Evaluating response to calcium therapy. Answer. B. Assisting with meal preparation. Question 33. A patient with Addison's disease reports nausea and weakness. Which finding requires immediate nursing intervention? A. Mild hyperpigmentation of skin. B. Serum sodium of 125 milliequivalent/L. C. Fatigue and weight loss. D. Decreased appetite and irritability. Answer. B. Serum sodium of 125 milliequivalent/L. Question 34. A nurse is prioritizing care for multiple patients. Which patient with an endocrine disorder requires immediate attention? A. A patient with hypothyroidism reporting constipation. B. A patient with hyperglycemic hyperosmolar state with altered mental status. C. A patient with hyperparathyroidism reporting bone pain. D. A patient with acromegaly reporting headaches. Answer. B. A patient with hyperglycemic hyperosmolar state with altered mental status. Question 35. A nurse is delegating care for a patient with Cushing syndrome. Which task is appropriate for an LPN? A. Assessing for signs of infection. B. Administering ketoconazole as prescribed. C. Developing a plan for glucose monitoring. D. Interpreting adrenal function tests. Answer. B. Administering ketoconazole as prescribed. Question 36. A patient with type 1 diabetes reports shakiness and sweating. Which nursing action reflects appropriate decision-making? A. Administering insulin to lower glucose levels. B. Providing 15 grams of carbohydrates and rechecking glucose. C. Restricting all food intake until symptoms resolve. D. Encouraging vigorous exercise to stabilize glucose. Answer. B. Providing 15 grams of carbohydrates and rechecking glucose. Question 37. A nurse is assigning tasks for a patient with hypercortisolism. Which responsibility is appropriate for a CNA? A. Monitoring for signs of osteoporosis. B. Assisting with skincare and hygiene. C. Administering mitotane as prescribed. D. Evaluating response to adrenalectomy. Answer. B. Assisting with skincare and hygiene. Question 38. A patient with hypothyroidism is prescribed levothyroxine. Which nursing action ensures patient safety? A. Administering the medication at bedtime with food. B. Educating the patient to take the medication on an empty stomach. C. Encouraging double dosing if a dose is missed. D. administering the medication with calcium supplements. Answer: B. Educating the patient to take the medication on an empty stomach. Question 39. A nurse is triaging patients with endocrine disorders. Which patient should be prioritized for immediate care? A. A patient with diabetes insipidus reporting increased thirst. B. A patient with thyroid storm with a temperature of 104 degrees Fahrenheit. C. A patient with prolactinoma reporting galactorrhea. D. A patient with hypoparathyroidism reporting muscle cramps. Answer: B. A patient with thyroid storm with a temperature of 104 degrees Fahrenheit. Question 40. A nurse is delegating care for a patient with SIADH. Which task is appropriate for an RN rather than a UAP? A. Assisting with toileting and mobility. B. Monitoring serum osmolality levels. C. Recording daily weights. D. Providing assistance with feeding. Answer: B. Monitoring serum osmolality levels. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!